All right, I want to show you an alternative to the standard cervical retraction or retraction extension. So in general, the movement that we want to use works very well in sitting, meaning I want, in general, I want the weight of your head and gravity to be pushing down. It tends to work better for most, but not all. So instead, we always want to start here. So in general, we're going to start nice and tall. The key is the hips all the way to the back of the chair. And then you're going to work on getting the head completely straight back, okay? So that's the cervical retraction in sitting. And when you can progress that, depending on how you feel, so you always want to monitor, like, is that pinching and making pain go down the arm? Only when I do it, like, okay, pain here, yep, I feel it, and when I stop, it goes away. Or is it the more I do this, the more I work into retraction this way, it's actually producing and making things worse. Okay, so if possible, we may have to, or if it's doing that, we may have to change to an unloaded or a lying down position. If you're okay, stay with that one, and then eventually you're going to want to go from retraction to retraction plus extension. Okay, as you add the extension backwards, it makes it a whole lot more aggressive, because now the weight of your head, you're getting more lower cervical extension. So if you've progressed and you just can't get there, it's continuing to make things, again, overall worse, not just temporary, like, yeah, I feel it, and then when I stop, it goes away. I feel it, I stop, and it goes away. It has to be worse. If that's the case, and you're just not able, over the course of a couple days, you're just not able to make progress with either seated retraction or seated retraction extension, then we're going to go to the table, and I'll show you an alternative way to do this. Once we move to unloaded or lying down, stay there, but don't be concerned with, or I want you to, again, after you're done with the lying down one, come back to sitting and test it again. Because now, after a few sets of lying, you may be able to do it in sitting, and it doesn't have the same negative effect that it did before. So let's show you the lying down variety. All right, so the laying down variety, you're going to want to get to the edge of, a table, if you have one. If not, the edge of your bed, so you can really feel like there's a drop off here, but you want a pretty firm edge on the side of that. So you're going to have to get far enough back to where you clear all of the cervical, all of the neck bones, kind of up into the upper thoracic. So I like to go back far enough to where if you put your arm to the side, your arm clears the edge of that, right? So if you're too far this way, it doesn't clear, you're not far enough up. You got to keep scooting up until your arm clears. Okay, so once you're here, then you're going to have to use a hand to hang on to your head. I would use the arm that's not affected. So in this video, my right arm is the one that's affected. I'm going to leave it here. I'm going to use my left hand to support my head. We still want to try to add the retraction here in lying, because now gravity is not pushing down this way, it's pushing down this way. So this should feel easier for those that just can't get it to work in sitting. So we'll still start back at the beginning, which is retraction. Again, I'm not coming down or back. My whole head is coming straight. See how it's level through here? And my left hand is just supporting the weight of my head. And it's helping me move straight back. So retraction first. And then if that's going well, you can add the extension by letting your hand kind of slide to the side, kind of by your ear, and let it roll back, okay, as far as you can. Now gravity is acting as a traction force. I'm getting some space as opposed to a compressive. And then you save it, come back with your hand, and pull your head back up. So you let it tuck all the way down first. The key, just like it is in sitting, the key is retraction first. Then let it roll back. Your hand kind of slides out the side door. Okay, let it come, maybe a little wiggle. You could add pressure here if you wanted to, but you don't have to. And then come back up. So as you go through those, right, 5, 8, 10 reps, get all the way down, get a bunch of them, go slow. Make sure you're getting to end range. You have to get to the retraction end range first, then let it roll back. Then you're going to come back, then you want to sit back up, and you want to retest. So then after that, you want to retest in sitting Check your baselines. How far can I rotate left? How far can I rotate right? Where are the symptoms? Are they further down? Are they further up? What's the intensity? And then, if that all feels better, like the symptoms are further up, I can turn better, then I would test it again in sitting in the chair and see if you can do it in sitting. You only want to do this one if you have to, and you want to use it as a bridge to get you back to being able to perform it in sitting as quickly as possible. So that's just an example of a slight regression of force for the neck and arm pain dealing with a disc injury in the neck. If you can't get it in sitting, then you come to the table, do it in lying, and then always think about when can I, or how can I return back to the sitting position.